3 years ago, a family in Bangkok noticed their 74-year-old mother was losing weight. They assumed she just wasn't hungry. 6 months later, she was rushed to the hospital, severely malnourished, confused, and with 3 untreated infections. The doctors told the family this could have been prevented. This story isn't rare. It happens every week across Thailand, Japan, Korea, and every country in Asia where families love their elders deeply but miss the warning signs until it's too late. Today, I'm going to show you the 5 warning signs that your aging parent needs professional care. Most families miss at least one of these, and missing even one can change everything.
Welcome to Aging Well Asia, the channel where we give you real, practical knowledge about senior care across Southeast and East Asia. I'm your host, and today's episode could be one of the most important things you watch this year. Stay until the end, because sign number 5 is the one that surprises families the most, and it's also the most dangerous to ignore. Sign number 1, unexplained weight loss or poor nutrition. When you visit your elderly parent and their clothes seem looser, or when you open their fridge and it's mostly empty or filled with food that's expired, that's not just a small problem. Here's what's actually happening. As we age, our sense of taste and smell decreases. Cooking becomes difficult. Getting to the grocery store becomes exhausting. And for many elders, especially those living alone, the motivation to cook just for themselves simply disappears. In Thailand, we call this quietly suffering in silence, and it is extremely common. A professional caregiver, even part-time, just 4 to 6 hours a day, can ensure your parent has proper meals, takes their medications on time, and maintains their weight. What to look for? Weight loss of more than 5 kilograms in 3 months, skipping meals regularly, or a refrigerator that's consistently empty or full of expired food. Sign number 2, increasing falls or mobility problems. Falls are the number 1 cause of serious injury in adults over 65, globally, and especially in Asia, where many homes have tile floors, steep stairs, and bathrooms without grab bars. One fall can mean a broken hip. A broken hip in an elderly person can lead to surgery, hospitalization, and in many cases, a rapid decline in overall health. But here's what most families miss. It's not always a dramatic fall. Watch for the small signs. Is your parent holding the wall when they walk? Are they avoiding certain rooms? Do they seem nervous going up or downstairs? These micro signs appear weeks or months before a serious fall happens. A trained caregiver is specifically taught to assess fall risk, modify the home environment, and support mobility, which keeps your parent safe and independent for much longer. Sign number 3, and this is the one most families miss: social withdrawal and changes in personality. When your cheerful, talkative mother suddenly becomes quiet, when your father, who used to enjoy TV and family dinners, starts staying in his room, when they seem less interested in things they used to love. Many families think, they're just getting older. That's normal. It is not normal. This is often one of the earliest signs of depression, early-stage dementia, or severe loneliness, all of which are treatable, but only if caught early. In Asia, there's a cultural tendency to normalize an elder's suffering. We tell ourselves they're fine. We don't want to intrude. But this silence can allow depression and cognitive decline to progress silently for months. A professional caregiver provides something irreplaceable: consistent human connection, daily conversation, and mental stimulation. These are not luxuries. They are medical necessities for aging brains. The research is clear. Elderly people with regular social interaction have a 50% lower risk of developing dementia compared to those who are isolated. Sign number 4, medication mismanagement. This one is silent but deadly. Most elderly people over 70 are taking between 4 and 8 medications daily. Those medications often have complex schedules, some with food, some without, some in the morning, some at night. Missing doses, double dosing, or mixing medications incorrectly is one of the leading causes of emergency hospitalization in seniors across Asia. Ask yourself this: does your parent manage their own medications? Do they know exactly what each pill is for? Have you actually checked their pill organizer recently? If the answer to any of these is, "I'm not sure," that is a red flag. A professional caregiver doesn't just remind, they document. They keep a daily log that you can review. They communicate with the family and the doctor. This one service alone can prevent hospitalizations that cost far more than any caregiver fee. And sign number 5, the one that surprises families the most: when you, the family caregiver, are exhausted. In Asia, family caregiving is deeply cultural. Children feel a profound obligation to care for their parents personally. And this is beautiful, but it is also, quietly, one of the biggest risk factors for poor elder care. When you are exhausted, you miss things. When you are overwhelmed, you become less patient. When you're stretched between your job, your children, and your parents, everyone suffers. Caregiver burnout is real, it's common, and it affects the quality of care your parent receives. Hiring a professional caregiver is not a sign that you have failed your parent. It is the opposite. It means you love them enough to make sure they always receive the best possible care, even on the days when you can't be there. In Thailand, professional in-home caregiver services start at around 15,000 to 20,000 baht per month, which, compared to residential care facilities, is significantly more affordable and allows your parent to stay in their own home, surrounded by family. Let's quickly recap the 5 warning signs. 1. Unexplained weight loss or poor nutrition. 2. Increasing falls or mobility problems. 3. Social withdrawal and personality changes. 4. Medication mismanagement. 5. Family caregiver exhaustion. If you recognize even one of these signs in someone you love, don't wait. Have the conversation. Explore your options. The earlier you act, the better the outcome. If this video helped you, please subscribe to Aging Well Asia. We publish new episodes every Tuesday and Friday, covering everything from senior care, healthy aging, and caregiving across Asia. And in our next episode, we're covering the complete cost breakdown of professional senior care in Thailand versus Japan versus Korea, so you know exactly what to expect financially. Thank you for watching. Take care of yourself so you can take care of the ones you love.